everybody. This is Dr. Brett Talley Daniel, MD, and I'm a neurologist and a headache doctor. And this is number 16 podcast, and the title is Betablockers for Migraine Prevention. So what are beta blockers? Beta blockers are what are called vasonormalizers, which prevent dilatation and constriction of the arteries in your body, mainly here talking about migraine, the cerebral arteries. Now, adrenaline, the stress hormone, comes with fear, and it comes in two varieties. It's an alpha, which works in the lungs, and beta, which works on arteries. Thus the name beta blocker, a drug which prevents vasoconstriction of arteries. So migraine is a condition where this vasodilatation occurs, and if you're vasonormalizing the arteries, it's preventive and helps migraine. The archetype beta blocker drug is Inderal, known generically as Propranolol, and it was the first drug approved by the FDA for treatment of migraines in 1974, and it's also used for other medical problems like migraine, benign essential and familiar tremor, hypertension, angina, which is the chest pain that heart patients get, cardiac arrhythmias. So the question for today's talk is, do beta blockers prevent migraines, headache symptoms? And the answer would be yes. The American Academy of Neurology current update for pharmacologic treatment for episodic migraine prevention for adults states that there is strong evidence of propranolol, metoprolol, and timolol, which are established as effective and should be offered for migraine prevention. They give this a level A, which is the highest working drug. And there's moderate evidence for another beta blocker named atenolol and nadolol, which are probably effective and should be considered for migraine prevention. They give this a level B. And weak evidence exists for nebivolol and pindolol, which are possibly effective, and give a level C on that. Acebutolol is possibly ineffective. It may not be considered for migraine prevention, level C negative. And there's insufficient evidence, which is conflicting or inadequate, to support or refute the use of bisoprolol for migraine prevention. Aha. So propranolol comes as a treatment in a short-acting drug like 10, 20, 40, 60, 80 milligrams, taking as divided doses twice a day or 4 times a day, or as an extended-release capsule as doses 60, 80, 120, 160 once a day. And the recommended dose for treatment is somewhere between 160 and 240 milligrams a day. Metoprolol, the dose there is 25 to 100 milligrams twice a day, and it comes with tablets 25, 37.5, 50, 75, and 100. And then timolol, the dose there for treatment is 10 to 30 milligrams a day as once a day or twice a day, and it comes in tablets 5, 10, and 20 milligrams. So the side effects, I'm going to list that for propranolol first, mainly fatigue, dizziness, possible constipation, bradycardia, hypotension, depression, insomnia, weakness, disorientation, nausea, diarrhea, alopecia, which means hair loss, and impotence. For metoprolol, the side effects are fatigue, dizziness, diarrhea, pruritus, rash, depression, dyspnea, bradycardia, sleep disturbance, and nightmares. And for timolol, bradycardia, heart block, fatigue, dizziness, headache, dyspnea, pruritus, Raynaud's phenomenon, nightmares, and impotence. So the FDA indication says the drugs are indicated for treating migraine, hypertension, angina, cardiac irregularities, and essential familial tremor. Now, propranolol is the main drug of this group, which I usually use for migraine prevention. It's usually well tolerated and has few side effects. And the only potential side effect I warn patients about is that a small number of patients will develop the so-called propranolol tired syndrome after they start the drug, which is usually in the first week. If this side effect develops, then the drug should be stopped. And I don't even try to change the dose. I just stop it. And another beta blocker could be selected for these patients. Beta blockers also may cause problems for patients with depression, diabetes, or asthma, or occasionally you'll see somebody with bradycardia will bother people if they're exercising. The duration of treatment for migraine, I commonly encourage the patient to consider using the drug for 3 to 6 months at first. They should chart their headache numbers per month and then reassess this on follow-up with the doctor. Many patients are able to get off the drug, although some patients with severe frequent migraine headache will continue. So that's it for today. My talk on Betablockers prevention for migraine headache symptoms. And God bless all you migraine patients. Please follow me or subscribe on my blog podcast post here. And I'll see you again. God bless you.